Detecting. Okay, now I can start officially. Thank you. So hello everyone and welcome to ASPHER and EUPHA Protecting Public Health webinar. My name is Avi Magid. I'm very happy to host this webinar and I will start with introducing myself. I am a Romanian-Israeli epidemiologist at Rambam Healthcare Campus, Haifa, Israel, a research associate at Ben Gurion University and a visiting scholar at Maastricht University, the Netherlands. I'm a member of ASPHER Emergency Task Force led by Professor Nadav Davidovich and the chair of Health Data Subgroup of the Emergency Task Force. The inspiration for this webinar is the recent expressions of concerns or calls for re-evaluation of WHO membership in European countries and beyond, which are often serving as a pretext for broader attacks on public health institutions and their work. This webinar reflects the understanding that it is time for us, public health professionals, schools of public health, and public health organizations to act, to strengthen public health, to advocate for public health, to come together and support the WHO and our health institutions. This webinar is a call for action. It is aimed to provide with real-life experiences from countries illustrating the tangible impact of WHO's work and the importance of WHO membership by presenting the on-the-ground impact it has. This webinar is the beginning of a series of initiatives aimed to highlight the importance of countries standing together with WHO and the importance of global cooperation in public health and to provide with tools to counteract the attacks on public health. I wish you a pleasant and fruitful webinar. And I would like to invite ASPHER President, Professor Henrique Barros, and EUPHA Executive Director, Charlotte Marchandise, for opening words. Please go ahead.
Good morning to all of you. Thank you very much for the organization of such a relevant webinar. I'd like to remember that since the old days of Society of Nations, as we all know, that countries understood the relevance of creating such a formal space of discussion, counseling, and common evaluation of health-related practice. The idea was that population health could be promoted, epidemics prevented, and mobility of people protected. As time went on, the complexity of this response increased, its relevance was larger and larger, and we truly needed to create adequate responses to such a complex phenomenon as health cities. Since the very beginning, ASPHER was created in close proximity with WHO. It means that both organizations recognize the relevance of organizing the health response in close proximity with those that were preparing the public health workforce. So everything that tends to decrease the relevance of WHO or tries to change its central role is obviously also affecting the relevance of ASPHER, the relevance of the institutions responsible for training, for educating the next generations of public health professionals. Thus is affecting tremendously the health scenario and our health perspectives. That's why this webinar is so important, and we truly need to find a common way to respond to the threats that we are living these days. I hope we will be able, by the end of these 90 minutes of discussion and presentations, to begin a stronger response to all these problems that we are facing these days. Thank you very much.
Thank you very much, Henrique. And Charlotte, please go ahead.
Thank you very much. So I'm Charlotte Marchandise. I'm the Executive Director of EUPHA, the European Public Health Association. And we are thrilled to participate because what we know is that even in our community of public health association, some of them are working really closely with WHO, and they know what is the impact, they know how important is the support of WHO, they know they can count on it. And I think the WHO report about Ukraine just was released. I was lucky enough to be in Ukraine, and I'm really happy that Rusłan from the National Ukrainian Public Health Association can come and give real life testimony of the work of WHO. Dziękuję. But apart from this country working very closely, I really know that lots of people don't know what is WHO, how does it work, what do they do, how are these people in the front line making a difference, but also how little they are, how little money there is for WHO, and it's a big brand. Everyone knows the logo, but not so many people know what lays behind. So this idea of this first webinar is to begin to tell a shared story between National Public Health Association, school, and all the public health communities to say we stand as one. We amplify the public health voices, each of us in our place, each of us in our role and competency, but together. And in a moment that WHO is at risk and WHO is fighting, we are standing together with you. So over to you.
Thank you very much, Charlotte. And I would like to thank Charlotte and Henrique for your insightful words. And I would proceed to the first part of the webinar, which is the country's perspective. And I am very happy to welcome Rebecca Ingenhoff from Germany, Dorit Nitzan from Israel, Carlos Signorelli from Italy, Oleg Lozan from Republika Moldova, and Rusłan Savchuk from Ukraine. So I wish us a pleasant session. And Rebecca, please start.
Thank you very much, Avi. Are you able to see my screen? Perfect. Yeah, thank you very much for the invitation and for giving me the opportunity to speak here today. I'm going to speak today on behalf of GLORA, the German Alliance for Global Health Research, which is based at the Charité University Medicine Hospital in Berlin, more precisely at the Charité Center for Global Health. And I would really like to highlight why the continued WHO membership is essential for public health, global health, and also highlight how our engagement and advocacy work shapes global health policy in Germany. Because GLORA is not a school of public health or a public health organization, I would like to highlight a bit our work of what we do and who we are. We are an association of researchers in Germany that focus on tackling today's global health challenges via interdisciplinary and global health research. We are really a member-driven organization which was launched in February 2020. We are sponsored by the Federal Ministry of Education and Research, and we also had some co-funding from the Development Cooperation Ministry and recently the Gates Foundation. And we have different aims. One is to boost the German contribution to global health research, focus on interdisciplinarity in global health research, support the next generation of global health researchers in Germany through workshops and webinars, and also beyond the academic sphere to include cross-sector partners. I'm part of the GLORA Secretariat, which is at Charité Berlin. We do have a steering committee of 19 experts that represent various disciplines, and we currently have 1,200 members from all disciplines. Our eligibility criteria to be a member is to be associated with the Public Health Research Institute in Germany. And currently we have 220 different public health research institutions through our members. To start talking about the WHO and our international activities, I would like to highlight briefly our international engagement strategy, why international engagement is important and why did we build a strategy for it. We believe it needs a strategy to advocate for global health funding and initiate policy impact by channeling the voice of our community So this is really one of our big work arms. As I lead the policy work at GLORA, this is where most of my work constitutes. We do collaborate with global health research networks in Europe and also on a global scale. And we continuously also advocate for increased access to funding. Talking about Germany's commitment to global health and its role in global health. I'm speaking from a high-income country's perspective in Western Europe, and as some of you may know, in 2020, during the first pandemic and during the first Trump presidency, Germany expanded its role in global health by significantly increasing financial engagement. Germany became the largest donor to the WHO in 2020 to 2021, and also has in the past heavily contributed to other initiatives such as COVAX, the Global Fund, or Gavi. And also our ministries such as the Education and Research Ministry or the Federal Ministry of Health have strongly increased their funding during the first pandemic. As some of you are probably aware, we just had recent elections in Germany, and the current coalition talks and shifting political dynamics in Germany may reshape priorities in global health and also public health. This may potentially affect funding commitments, multilateral engagement, and also the country's leadership role in various initiatives such as the Global Fund or the WHO. Just to give you an example, the Ministry for Development Cooperation, the BMZ, as we call it in Germany, who has been a large funder of global health, and especially in the humanitarian space, there are currently talks that this might be merged with another ministry, which also will have a negative impact on global public health. To give you our GLORA perspective, why do we think the WHO matters and where do we really see its importance based on our experience and our work? We do see a significant role in the global health data space, especially towards infectious diseases such as malaria, tuberculosis, neglected tropical diseases, vaccinations, and emerging risks, especially in light to future pandemics. We do see that this is very important, particularly for countries that do not have the capacity to have national data spaces. And in that sphere, the WHO is really critical to provide global health data on a worldwide scale. We also see the role of the WHO in providing health standards and guidelines. Just to give you an example, for cervical cancer screening and vaccination, this has really evolved a lot in the last decade. And this is a lot due to the work of the WHO in setting standards and guidelines for these interventions. We also see a big role in the convening power of the WHO because it is a neutral organization. It is uniquely positioned to negotiate for global public health. Then one big field that we also support strongly in Germany is the pandemic prevention program. We do have the WHO hub in Berlin, and the German government supports that strongly. And lastly, in the field of planetary health, which is largely evolving in the last years, Germany has particular strength in heat, air quality, and policy. Where we do see opportunities for Germany to contribute beyond its funding commitment is scientific expertise and representation. As GLORA, we advocate for stronger representation in global health advisory boards. The advisory committees of organizations such as WHO, CEPI, Gavi, etc., are really guide the scientific work. We did conduct a study, a desk research study at GLORA, where we mapped the scientific advisory board of 17 organizations, and they were really heavily dominated by the US. And there we see a big role of European stakeholders, European experts, or also global experts to volunteer for these advisory boards and really help shape the work of the WHO in the future. We really look forward to publishing a commentary and a policy brief on that soon to really support the WHO further beyond the funding and on an individual scale. To talk more about our policy engagement as GLORA and our partnership, we've engaged directly with policymakers and stakeholders in Germany through various events, policy input, and formal partnerships to ensure global health remains a national priority. And from our experience, to support the WHO, strengthening global health on a national and European scale is important, because without understanding the importance of global health, such as pandemic preparedness, advocating for the WHO itself is rather difficult. In Germany, in the past legislative term, we were very lucky to have a subcommittee on global health, which was really a cross-party engagement of various politicians focusing only on global health. It is currently unclear if this will constitute again in the next legislative term. But through this, we were really able to put out statements during plenary sessions on the importance of global health and the WHO. We also conducted various policy engagement activities and events, for example, the steering committee that we have that I introduced briefly before. We conducted a public affairs training for them to really employ them with methods to engage with politicians and also create a multiplier effect there. We did host several events, such as the World Health Summit, which is a great forum to reach a diverse audience, and also parliamentary evenings in Germany to advocate specifically towards the German government. As I mentioned before, Germany's focus on multilateral engagement has been seen in several political actions, one of them being the WHO Hub for Pandemic and Epidemic Intelligence, which is mostly funded by the German Ministry of Health. Its convening power is very important. We do have a strategic partnership through the Charité Center for Global Health with it. And this is really one area where we see the importance of Germany for the WHO to strengthen early warning and the outbreak response in light of potential future pandemics. To maybe bring in some practical recommendations, what public health associations or universities could do to strengthen the WHO through science, media, or policy. As I mentioned before, the scientific advisory boards of WHO really drive the scientific work. So if you're an expert in public health or global health, you can apply to these calls or nominate peers for advisory roles. As GLORA, we have a pretty active LinkedIn channel, and we often post new opportunities for interested experts. To use media strategically to position your statements, also work with partner networks through tagging them or hashtags really works very well to amplify messages. And to know your target group. What message do you bring to policy makers? What do you bring to peers? What do you bring to partners? And how do you frame that message? Advocacy, our work in Germany. In the past, we identified global health champions, decision makers in ministries or the parliament that we build long-term relationship with and really create long-term dialogue with them. In Germany, often also the parliamentarians have strategic advisors, which are often easier to reach than the parliamentarians themselves, and to build strong connections with these through events or direct outreach was very fruitful for us in the past. As I mentioned before, we did several policy engagement activities, and one other point is to focus on the thematic leadership strength of your country. So for Germany, it has really been in the past years, pandemic preparedness. There's a lot of political buy-in because it has a global relevance and politicians are supportive of it. Promote coordination over fragmentation for the WHO. We do see the WHO strength in the coordination power and believe that the in-country operations should be managed by in-country organizations. And lastly, to empower researchers to develop a policy lens and to be able to communicate to policymakers in the appropriate ways. To end, I would like to give you a slide overview of the policy work we did to advocate for the WHO and also for other global health themes that are closely connected. We just at our start, when the US first launched the withdrawal threats, we published a statement strongly supporting the WHO and its science. And in the past, we also published various position papers on equitable partnerships in research, global health financing, and also lately a joint call with Berlin-based institutions for Germany's leadership towards the WHO. All these material are available on our website in German and English, and maybe it could give you some inspiration for your advocating work. Thank you very much for your attention. This is my contact information, and thank you again for inviting me to speak here today. I'm looking forward to any questions and also the rest of the seminar.
Thank you very much, Rebecca, for your nice and insightful presentation and for your great contribution.
Thank you.
And thank you. And I'm very delighted to welcome Dorit Nitzan.
Yes, hello. Thank you very much. I'll share my slide. Can you see it?
Now we can see it, yes.
Yes, I'll just make it larger. So is it okay?
Yes.
Right. Okay, thank you so much, Avi, and thank you, everybody. It's a great honor for me to be here. It's an honor and yet very bad experience here. And I am going to share with you what's going here. I'm here presenting the Israeli Medical Association, the Israeli Public Health Association, the Israeli Schools of Public Health. And just to let you know that I am back to Israel after 17 years in WHO, in which I was in the last years as the regional emergency director, but before as the WHO representative to Ukraine, to Serbia, and so happy to see my colleague, my friend from Ukraine here with us. So I'm going to give you the story that is told upside down. Really, what is going here is just unbelievable. I'll show you how facts and real things are turned on their head and are really, thrown into a puddle. And my story is the story from the puddle. And I will describe, or every time I speak, think of the three vectors that are pushing and pulling and asking to get Israel to exit WHO. These are 20 parliament members. We call it Knesset, our parliament. Very specific parliament members that are coming from what we call here right-wing, nationalistic, and I can go on and describe it. I stop here. And the other group is those that deny Corona and refuse and actually are the anti-vaxxers. Okay, so these three groups have joined together with a common interest to just get out of WHO, but not only that, to establish another alternate organization. And these talks are ongoing. And therefore, I thought that it is so timely that we are holding this meeting. I'm not going to give you all this, but just to show you how the story of building something amidst crisis is used in the wrong way. The story is, what do you want? Franklin Roosevelt declared that he coined the term UN for the Allied power, and later on it became the UN, but what was there before? Don't forget that this came after the Second World War. What was after the First World War was the League of Nations. So things do change. Do not stick to one model. Every few years, things need to change. And the COVID is it's like the World War scenario that calls for change, for global change. Just a second, it got stuck. Oh, okay. They also bring to our attentions that the UN has these specialized agencies, which is really true. And, you know, they use the right things, as I told you, and they say, look at that. The UN has its own governance structure, budget, and mandate, while aligning with the broader UN agencies, meaning that there is something wrong here. It's if the UN is not functioning, it is not functioning, and if the UN is functioning and doing something wrong, then the WHO is also part of that. And yet they recognize that it is specialized agencies, and you can get out of specialized agencies quite easily. You don't need to leave the whole group. So they use it as, you know, in two ways. The other thing is, again, with the formation of WHO, the history. We had the International Office of Public Hygiene that was established 1907. As I said later, the League of Nations with the League of Nations Health Organization in 1920, and then it changed itself and joined the new UN in April 7th. Just now we are celebrating the birthday. And then the Constitution, which I think is the WHO Constitution, which I think is such a great document. They look at the holistic definition of health as a mean to get and infiltrate into our societies, into our brains, and into our lives. They look at this as, and they said it in the Knesset. Do you know that WHO is actually defines health as physical, mental, and social dimensions? This is horrible. Why don't they focus only on health? If they focus on the medicine part, look what they do to us. And health as a human right? Did you read that it is there? Do you know what are human rights? And then they go for health, for peace and security. They are taking our sovereignty. They don't want us to decide what's good and what's bad on us. So these three beautiful things that constitute the constitution of WHO became the curse, this upside down world. Then comes the WHO objective, the attainment by all people of the highest possible level of health. All people? Take care of your own people first. Who are you to take? Why are you telling us to do it differently? And all people rather than all nation is also, what does it mean? And as you can see, the other parts of it, the aspirational standard, I call it the phrase, highest possible level. Who would tell us what is the highest possible level? Look at us, we have universal health coverage, etc., etc. Of course, I'm saying it in a tone that they said it much more harshly and not at all with a smile. So just to mention that. They look at the WHO functions, direction and coordination. What does it mean? Leadership on global health matters. Why? Research promotion, they have their own ideas because they're connected to the industry, to other things that are doing that. And the same about collaboration, technical support, and standard setting. As for the WHO membership that is in Article 3 to 8, they look at the observers and the right, the associate members and the rights, and then the member states. And then it was obvious that the US, according to that was said by the people like us in the meeting, that the US can leave WHO because it was stated in the founding agreement of the US with WHO. But other countries, especially in this case, Israel, cannot leave WHO. They can stop paying their contribution, assessed contribution. After 2 years, WHO can decide to let them go or stay. So This created some kind of a very kind of chaotic understanding that even the words matter here. The fact that WHO has 6 regional offices with more than 150 plus country offices and currently 194 member states, they claim that in that regard, the countries that benefit are the developing countries. Countries like ours are actually givers, so they should be considered in a different level there and different kind of ability to contribute to the organization or not. They also look at the top funders of the WHO. Yes, as you mentioned, Germany, yes, number 2. Great, that's wonderful. US is out. And if US, that's what they said. By the way, US is not out yet, but US, they claimed, is out. What is going on? The alternate organization that they are building will take over and bring all those funds back to the right places. The fact that the 80% of funding comes from just 20 donors and the fact that Bill and Melinda Gates and all those words, you know, they just created another set of ways. The global health risk of the US withdrawal, when we discuss it, and you know what I'm presenting here, these are parts of the paragraph that we have submitted to them and how they turned it all to the other side, right? So the global health risk of the US withdrawal is weakened disease surveillance, reduced health system support, and diminished research capacity. Great. So why to stay in this organization? If the US leaves, we should leave because this is going to fail. And the other thing is that what will happen is the power vacuum and the multilateral fragmentation. Don't worry, this will be glued into another alternate organization. The power vacuum will not stay there, and therefore the US and its allies, when they leave, things will create a better and a more, you know, a world that is healthier medically, from the medical point of view. Israel has very good history with WHO. Israel has been part of WHO, and the WHO also moved towards Israel in 1985 when it agreed to move Israel from the Eastern Mediterranean region to the European region. This was agreed in the World Health Assembly vote by the member state. We have very close relationship with the European region. Hans Kluge has been in Israel. He expressed his support to the country and is very appreciated, as well as our WHO representative, Dr. Michel Tirren. They both are really liked. However, from the Geneva point of view, the words, the non-supportive reactions are taken very seriously by the Knesset members. We try to explain the benefits of Israel's WHO membership. We go into the details. You will have the slides, so I'm not going to read it, but of course we do have that. We also revealed and showed and shared Israel's contributions to global health and what we have been doing, and that it's actually coming back to us, because if we send an emergency medical team type 3 to help the world, they now help here. So, you know, we tried our best. By the way, Manfred Green was with me. Nadav Davidovich was there as well in the Knesset and did a fantastic job. And all of us were hit twice. I mean, we had 2 meetings of a committee, the health committee, and the 3 of us were absolutely attacked by them. we tried to describe, nobody listened, the European regional programs that are so helpful for us. And we explained the risks of Israel leaving WHO, the isolations, security risks, limited access to real-time data, diminished voice, etc. All those were very clear to us, very not clear to the others. We also spoke about the importance of WHO in bridging for peace, for sharing information, for giving us also information and intelligence from what is going on around us, from our neighbors, that some of them are not friendly to Israel and vice versa. And I don't think that here we have enough information to support that, because I think some things that when I speak with my friends in WHO, I ask to emphasize better, to make it easier on us to show that it is happening and not to hide it, because we all know that it's happening, but it's not there, out there. We also actually, Manfred found that a story that the Israeli Medical Student Organization was voted out of the International Federation of Medical Student Associations, and that the platform of the EB, the executive board of WHO, actually provided a platform for the member states, for the members to vote and to agree and to ask the IFMCA to bring back the Israeli medical student organization. This happened just now in March, and this is a very good example of WHO convening power and ability to listen and to say to organizations, do not kick out Israel, because we recognize you as an organization, stay with us as well. So this was very, very important. And yes, we have to discuss internally about the future of global health governance. We have to really openly think about it, how to respond to it, and how to move to the next generations. And what are the roles of member states, how we take it together, and what will come out of this discussion. It's important to remember that part of this discussion, especially the one from the ultra-nationalist organizations, is due to the pandemic agreement, the IHR, and the feeling that post-COVID, WHO wants to control the world. And something is wrong here. We don't say it out loud, and we don't repel it in a very understandable way. We explain and will continue explaining the WHO continued relevance as the only universal leader of health in so many aspects, and that it's part of our health system. Each and every one of our doctors and nurses know that. Some don't understand it, but they all live with some parts of WHO involvement, if it's the ICD-11 or 12, or if it's something else. But some of them do not understand what it means. So I think that for I'm not expecting any answers, but just think that I keep asking myself is, how does the WHO balance technical authority with political reality? I think that has to be touched, because being outside, in a way, from the UN, it has some expectations. It brings some expectations. We expect that politicization will stay out, and of course, it's not. What lessons can smaller countries like Israel learn from the US withdrawal from the organization? What does it mean? Should we just follow them? We know that our prime minister is now flying to Hungary. He's going to be there 5 days. We know that they're speaking with other countries. I'm not going to mention the names now, but they are talking actively with these countries. So we have to think about it and be aware of it right now, and not to wait to it. for it. How might WHO governance evolve to meet health challenges of the 21st century has to also come, and I think here we need to work with WHO, and I see my friends there. What role should non-state organizations play in the WHO funding governance? Very important. And leaving WHO, the question that was raised here, is it really possible or not? What would be the impact? Would there be an alternative organization, which we already see them flying, and etc., etc.? These are the questions that I'm throwing to the air, and I can tell you we are fighting here with Avi, with Nadav, Manfred, Chagai Levin, and others to stay within the WHO. And I thank my colleagues in WHO as well. Thank you.
Thank you very much, Dorit, for this very important and insightful presentation. We learned a lot, and thank you for your contribution. And I'm very happy to invite Carlos Sediorelli from Italy.
Thank you very much. Good morning, everybody. If you can hear me, and I try also to share my presentation. Please give me, Avi, can you see the presentation?
Yes, yes, I can see it.
And I thank you very much. It's an honor for me to be here today and to discuss the crucial role of national public health association in countering skepticism towards WHO membership. As past president of the Italian Association of Public Health, I wish to emphasize the critical importance of Italy's continued engagement with WHO and illustrate our country's strong commitment to global health cooperation. Italy has a long and fruitful history of collaboration with WHO, both with its quarter in Geneva and its European office in Copenhagen. Our joint efforts span key public health initiatives from vaccine programs such as the European Vaccine Action Plan, Global Vaccine Action Plan, Polio Eradication Initiative, Non-Communicable Disease, Antimicrobial Resistance, Health Emergency Preparedness, International Health Regulation, where Italy had an important technical role. In addition, training young professionals, a lot of possibilities for them. And we also have to mention that we have one office in Venice and 26 collaborating centers in different towns and different institutions and different universities. 4 of them are located at the National Institute of Health in Rome, where there is a strong collaboration with WHO, both Geneva and Copenhagen office. Despite recent proposal in our parliament suggesting a re-evaluation of WHO membership, it is essential to highlight that the vast majority of public health and scientific community, I would say almost all of them, supports remaining within WHO. The international scientific collaboration and evidence-based policy making that WHO facilitates are indispensable in our point of view for our nation's health security and progress. While there have been political debates about Italy's role in global government, this discussion should not overshadow the profound benefits that WHO provides. We must also acknowledge that Italy has maintained a solid diplomatic relationship with the new US administration led by Trump, which at the time took a crucial stance towards WHO. Nonetheless, Italy has consistently upheld the principle of multilateralism and scientific cooperation, recognizing that global health challenges require collective solutions. And I would like to show the official declaration, the government position, last 29th of January from the Minister of Health. At the moment, the Minister of Health is a colleague, a medical doctor, former rector of one of the three universities of Rome, Professor Schillaci, who clearly stated the Italian position. Italy will not leave WHO, even if more transparency on the use of funds is needed. This has done after that there were some proposals in the parliament immediately after the beginning of Trump administration. That being said, we must be candid about areas of concern. The response of WHO during the COVID-19 pandemic was not universally praised, including Italy, where certain aspects of the crisis communication and initial response strategies were questioned. While the organization played a fundamental role in coordinating international efforts, some criticism arose regarding the timelines or clarity of guidance. However, rather than questioning our membership, this reflection should drive us to engage more actively within WHO to strengthen its effectiveness and responsiveness in the future crisis. Additionally, Italy's government has not always aligned with WHO public health recommendation, particularly regarding the recent campaign on alcohol consumption risks. Some economic sectors view the WHO stance as a direct threat to their interest. However, as public health advocates, we must reinforce the message that health policy must be guided by science and the protection of public well-being, not in a short-term economic concern. It is crucial that WHO alcohol campaign deliver clear messages, emphasizing that varying level of consumption pose different health hazards. In conclusion, Italy's commitment to WHO must remain steadfast. Our advocacy effort should focus on reinforcing Italy's role as a leading contributor to global health, while constructively engaging in discussion on WHO reforms where needed. Abandoning this collaboration would not only weaken our capacity to tackle future health crises, but also isolate us from a global network that ultimately serves to protect the health of all Italians. Thank you very much.
Thank you very much, Carlo, for this interesting and nice presentation. Thank you so much for your contribution. And I'm very happy and excited to welcome Oleg Lozan from Republika Moldova. And after that, Rusłan Savchuk from Ukraine. And we have until 12 p.m. or 12 and 2 minutes for this part of the webinar so that we can meet the schedule. So I'm very happy to welcome you, Oleg. Please go ahead.
Thank you so much. Thank you so much, Avi. Ladies and gentlemen, it's a great pleasure to present you greetings today to one of the most important authorities in the field, to the World Health Organization. From the institution, I will give the institutional point of view of the advocacy of the meaning of the support of WHO for our country. Because I have the honor to lead the School of Public Health Management, the institution that is only institution in the country that trains master in public health management and provide continuous medical education for managers. We have trained more than 500 masters in public health management during 20 years. And during these 2 decades, with the support of several national and international organizations, especially World Health Organization, the School of Public Health was founded. Among the minor events, we highlight the year 2007. Then in Valencia, in Spain, our institution became the member of Association of the School of Public Health in the European region, ASPHER, which offered the opportunity to access to European value in the field. This year, we are celebrating 20 years anniversary of the launching of the Public Health Master Program. We recognize that the dedication, creativity, and passion invested in this project over the past 2 decades have been invaluable. The program has significantly influenced our community and continues to inspire us today. In gratitude of support we receive from WHO, we established a wonderful tradition from the beginning to deliver the first lecture to the WHO representative to the country of the Republic of Moldova. And this tradition is greatly appreciated, continuous, and it is a real benchmark of the special relation we have with World Health Organization. Our collaboration with WHO is present in all objectives of the School of Public Health Management and has transformed the concept of training in the field in the Republic of Moldova through training, research, and consultancy. WHO support was very consistent. In 20 years, we published more than multiple textbooks, manuals. Many of them did directly with support of WHO. For example, it's only last year we have published 2 important manuals for different targets of public health specialists in our country. Also, this year, in 2025, with the support of WHO, we translated the first edition of the Fundamental Public Health Manual by Professor Tulczynski. This achievement is symbolical because 10 years ago, 2015, our university awarded the title of Doctor Honoris Causa to Professor Tulczynski. This honor recognized his substantial contribution to the launch and developed the master program at the School of Public Health Management in Republic of Moldova. Also, we have big support in research. WHO also contributes to develop the high level of research at the School of Public Health. Among the most important research project was related to the migration of medical workers. And to maintain the high standard of research, we also, with the support of WHO, last year we had the WHO course, Good Health Research Practice. It's also very important to keep the standard in this area. We have also a special chapter in the history for the field of public health education in the Republic of Moldova, a reference for the very high value that was conferred by the presence of these special personalities here in Moldova 9 years ago in 2016. Her Majesty Queen Mary of Denmark and the WHO Regional Director at that time of Europe, Joanna Jacob, became Doctor Honoris Causa of our university and honorary professors of the School of Public Health Management. And this is also it's a very important historical moment for us. WHO has consistently invested in capacity building in the Republic of Moldova. Please see some of the most relevant training areas from recent years. All of them are very important for our system. But we also invested in the WHO. However, the greatest value of the School of Public Health Management lies not in research textbooks, articles, monographs, but in its graduates. The school has produced a significant number of specialists who works in public health system. the private sector and governmental agencies and Ministry of Health, non-governmental agencies, different kind, other agencies. But I want to special highlight the graduates who work in international organization, particularly in WHO. We have, I believe, the largest proportion of graduates employed at the WHO headquarters in Geneva, in regional office in Copenhagen, and many other offices around the world, including WHO country office in Moldova. These professionals form a unique collective known as WHO Diaspora. We call it WHO Diaspora, which is very engaged, even from a distance in academic activities of the school. Each year we have fantastic debates on global public health topics supported by this diaspora. This is something truly wonderful that we are very proud of. It's often said that we should be grateful for the challenges in life, as they help us appreciate the truly important things. WHO is not just a partner. In our case, an institutional point of view, is part of us. WHO serves us as our tuning fork, enabling us to communicate in a shared language, the language of global public health. Is in today's global world, in the new, let's say, normality, advocating for WHO is, in a sense, advocating for my institutions and the incredible potential we can unlock together. Education is the most powerful weapon to change the world, say Nelson Mandela, but we have privilege. We have this privilege. Thank you so much.
Thank you very much, dear Oleg, for your nice and great presentation. And it was very insightful, and thank you for your contribution. And last but not least, I would like to welcome Rusłan Savchuk from Ukraine to speak. So please go ahead.
Вітаю, колеги. Я сьогодні хочу заручитися підтримкою мого колеги. Він буде здійснювати переклад. Це пан Михайло.
Hi everyone, I'm here with my translators, so Mikhailo.
Ви знаєте, що я голова Всеукраїнської асоціації фахівців з громадського здоров'я.
You know that I'm the head of All Ukrainian Association of Public Health Specialists.
Мені сьогодні особливо приємно бути перед вами тут і представляти нашу 5000-тисячну асоціацію.
It's an honor for me to be a part of and to attend in this webinar and to represent all 5,000 members of our association here.
Я хочу вам нагадати про те, що наша асоціація в Україні є особливою.
I want to tell you and remind that our association in Ukraine are the unique.
І особливість полягає в наступному.
And its unique is in.
Ми сьогодні об'єднуємо такі важливі напрямки, як наука, освіта.
We have representatives from a scientific sector, from university sector and other.
Практики, а також наші громади, яких в Україні є дуже-дуже багато.
And also we have the community leaders in our like our representative and practice and CDC and so on.
Ми маємо сьогодні гарну співпрацю з нашими урядовими організаціями, такими як Міністерство охорони здоров'я.
We have a connection with our governmental and governmental organizations such as Ministry of Public Health and Ministry of Health.
З міністерством, яке займається питаннями ветеранів.
Also with ministry who is working on veteran items.
Соціальної політики.
Social work.
Ну і рядом інших урядових організацій.
And other governmental organizations.
І ми маємо своє представництво в кожній області нашої країни.
And we have also our representatives in all the regions in Ukraine.
І там є досить велика кількість наших представників, які сьогодні зацікавлені в розвитку нашої асоціації і в підтримці громадського здоров'я в Україні.
And we have a lot of members who wanted to improve public health and improve the leadership of our organization.
І дякую великій Європейській асоціації за підтримку нашої політики і за прийняття нас в свої ряди. Нам достойно і за честь бути з вами.
And I'm really grateful for EUPHA, for all EUPHA members that you are accepting us in your family.
Дякую кожному з вас, що підтримуєте нашу країну, мою Україну.
And thank you that you're supporting us, and thank you that you are supporting us, and thank you that you are supporting Ukraine. Thank you.
Особливо в такі важкі часи, коли здійснена неспровокована агресія щодо нашої країни.
Especially in that times when we are on unprovoked war aggression against Ukraine.
Я сьогодні хочу підтримати Всесвітню організацію охорони здоров'я.
Today I want to support the World Health Organization.
І хочу вам представити основні досягнення організації у підтримці України за 2024 рік.
And present to you its key achievements in 2024.
І організація, яка забезпечила стабільність системи охорони здоров'я України.
And the organization who made the stability of public health sector in Ukraine.
З початку повномасштабного вторгнення ВООЗ сприяла постачанню медикаментів.
Since the full-scale invasion, WHO has facilitated the supply of medicine,
допомагала з забезпеченням медичного обладнання,
helped with medical equipment,
для мобільних клінік для надання допомоги у прифронтових та окупованих регіонах.
And mobile clinics to provide assistance in frontline and occupied regions.
Завдяки такій підтримці було забезпечено доступ до життєво необхідних медичних послуг для мільйонів українців.
Thanks to this support, millions of Ukrainians have had uninterrupted access to essential healthcare services.
ВООЗ активно працювала над відновленням зруйнованих медичних закладів.
WHO has actively worked on restoring damaged medical facilities, supporting hospital reconstruction,
допомагаючи нам з реконструкцією лікарень,
improving sanitary condition,
покращенням санітарних умов та забезпеченням психосоціальної підтримки для пацієнтів і медичного персоналу.
And providing psychological support for both patients and healthcare workers.
Всі ми знаємо, що в умовах війни ризики спалахів інфекційних захворювань значно зростають.
The war has significantly increased the risks of infection disease outbreaks.
І для нас важливо, що ВООЗ розширив програми вакцинації.
WHO has expanded vaccination programs,
роблячи акцент на таких інфекційних захворюваннях, як кір, поліомієліт та COVID-19.
particularly against measles, polio, and COVID-19.
ВООЗ допомогло Україні впровадити систему епіднагляду.
It has also implemented an epidemiological surveillance system,
програма, якою особисто я як лікар-епідеміолог користуюся.
Program that I'm usually using.
І ця програма допомагає швидко виявляти та реагувати на спалахи хвороб.
That helps quickly detect and respond to disease outbreaks.
Окремо хочу відзначити допомогу ВООЗ щодо підтримки психічного здоров'я.
WHO has placed special emphasis on mental health issues.
Завдяки активності ВООЗу було створено мережу центрів психічного здоров'я.
A network of psychological support centers has been established by support of WHO.
Постійно проводилися тренінги для лікарів.
Training session for doctors are on dealing with post-traumatic disorders were started all over the country.
А також було забезпечено доступ до медикаментозного лікування для людей з психічними розладами.
And also has been and provided the access to medication for people with mental health condition.
ВООЗ виступила ключовим координатором міжнародної допомоги в Україні.
WHO has played a key role in coordinating international aid for Ukraine.
І для цього вони залучали ресурси та експертів з різних країн.
Mobilizing resources and experts from various countries.
В моїй презентації ви зараз бачите останні дані, які були презентовані ВООЗ буквально на днях.
On my presentation, I'm showing you the data from the last report of WHO in Ukraine.
І це якраз ті важливі ключові акценти, які допомогли Україні.
And these are the key accents which helped Ukraine.
Залучаючи ресурси і експертів з різних країн, ВОЗу вдалося підвищити ефективність використання коштів і запровадити нові технології в охороні здоров'я.
Thanks to WHO efforts, Ukraine's healthcare system has been able to withstand wartime challenges and even strengthen its crisis response capacity.
Ну і звісно, завдяки підтримці ВОЗу Україні вдається вистояти у такі важкі часи війни.
And during these war times, Ukraine is holding just and thankfully for this, like with the support of WHO.
Організація продовжує підтримувати Україну, адаптуючи свої програми до нових викликів та сприяючи відновленню медичної інфраструктури.
The organization continues to support Ukraine by adapting its programs to new challenges and contributing to the restoration of medical infrastructure.
Ну і ми у Всеукраїнській асоціації фахівців з громадського здоров'я дуже цінуємо співпрацю з ВОЗ на всіх рівнях.
We at the All-Ukrainian Association of Public Health Specialists highly value our cooperation with WHO at all levels.
Ну, безумовно, підтримка є надзвичайно важливою для зміцнення нашої системи охорони здоров'я та забезпечення стійкості перед викликами.
Their support is critical in strengthening our healthcare system and ensuring its resilience in the face of challenges.
Дякую всім за увагу.
Sorry to interrupt. We have one more minute for this presentation. Oh.
Yes. So, ми маємо ще одну хвилину для цієї презентації.
Ми тісно співпрацюємо з ВОЗ на всіх рівнях і наша асоціація, зокрема.
We are working with WHO on all the levels and our association in the front line of the working with the WHO.
Хочу також сказати, що я сьогодні представляю не тільки асоціацію, а й регіональний центр контролю профілактики хвороб.
I'm representing not only the association right now, but I'm also the head of regional CDC department.
Яка займається профілактикою інфекційних та неінфекційних захворювань.
We are working on prophylaxis on infection non-communicable diseases.
Буквально цими днями у нас були представники ВОЗ, які аналізували рівень щеплення в нашій області, в Бауernfranківську.
We had a meeting with the WHO a few days ago, and we analyzed the levels of infection level data in our region.
І та підтримка професійна, яку ВОЗ надало нам, будучи з такою місією, інспектуючи в нас, вона дала можливість нам відкоригувати наші показники щеплення і залучення населення до вакцинації.
And this support of WHO give us an opportunity to correct our way to the better vaccination process and better fight against infection diseases.
Ну і під завершення хотілося б сказати, що ВОЗ і її представники сьогодні активно доїжджають до територій, які є прифронтовими, і вивчають ситуацію зсередини.
And in the end, I want to say that I would like to say thank you for WHO representative who are working on the front line, and they're moving there and they're helping like on the territory really close to the front line.
Тому ми надалі хочемо, можемо і готові співпрацювати.
So we are ready, we want to, and we will work together.
Дякую.
Thank you.
Thank you very much, dear Rusłan, for your great presentation and great contribution. And before ending this part of the webinar, there is one question from the audience to Carlos Inirelli, please. So the question is it possible to absolve an internship as a student at WHO in Rome?
Well, that might be a private answer also,
yes,
right?
now it's yes. So yes, so I think it's private, but it was written in the
What do you mean? I see my collaborator that has that my name also is Carlo Lunetti, but anyway.
Oh yeah, I just saw it, and when
No, I saw him because he's a resident that now is working in Brussels at ASPHER office. What the internal is from WHO to Rome, but where in Rome?
Okay, so maybe I think
We
we'll leave it
the person
to
can
private.
write to me, and I will
Yeah.
ask.
Yes. Okay. So I'm very happy to move to the next part of the event, and this is the reflection from the WHO Europe. And I'm very excited to welcome Natasha Azzopardi Muscat, the Director Country of Health and Policy Systems of the WHO. So please, Natasha, go ahead, and to meet the time, the agenda of the webinar, we have about 6 minutes for this part. Thank you, Natasha, and welcome.
Thank you. Good afternoon, Avi, and I see Charlotte and many colleagues, Carlo, Dorit, and others. Let me first start by thanking ASPHER and EUPHA for having convened this webinar. It's very timely and very important. And of course, you all know that I very much feel like family with these organizations, and I feel your support, and I convey the greetings also of our regional director, Dr. Hans Kluge, who also recognizes your work really in supporting public health in these difficult times. And this is not just actually about WHO, colleagues, friends. This is about public health being challenged in ways that we haven't really seen in our lifetime, even though some of us have been around for quite a while, and at least a quarter of a decade, if not more, militating in the area of public health. This does not mean that we should be disheartened. I think it actually forces us to rethink how do we need to strategize, what tactics do we need to employ to ensure that ultimately we continue to be of service for the health and well-being of people. Because what is clear is that whilst the world is passing through a turbulent phase, the need to promote and protect health and well-being has probably never been greater than it is now, but will become greater in the immediate and near-term future. And let me just explain perhaps 2 or 3 points. In this sense, you have heard from countries like Moldova and Ukraine how WHO is still very much present, working with countries in several countries across our region, particularly in the eastern part of our region. But what we have seen since the COVID pandemic, and this is very interesting, is that even in high-income countries, they are coming to WHO Euro in particular, asking for help and support to deal with new and emerging phenomena that no country, no matter its size and wealth, can deal with on its own if it truly wants to promote and protect the health of its citizens. And let me just give a couple of examples. So cross-border health threats, for example, when I first joined WHO, Dorit, it's been over 5 years ago now, one of the first things I was told is that emergencies is not a big issue for the Euro region. How things have changed and how they are set to change, sadly, in the years to come. We were in meetings last week with the European Commission, and it's very clear that the tilt is towards preparedness, and preparedness now not just for viruses, not just for AMR, not just for climate, but also for defense. And what does this mean? This means, of course, that we need to keep our structures in place, the vigilance, the surveillance, that is so important that just WHO is doing. But also, we need to keep monitoring what is happening with the health of our citizens. And again, here WHO has a key role. I refer to the European Health Report. Many of you joined the webinar, which we had a few weeks ago when we launched the second edition of the European Health Report. Who is going to continue to maintain oversight in an independent manner of the health and health status of European citizens? We need to continue to work closely together with our collaborating centers, with academia, not least, for example, on projects like the Health Behavior Survey of School Children, which has again drawn to light the complexities and the effects that the digital determinants are having on the mental health of our children and adolescents in the region. But of course, not least, for example, this is the time when work done by our Barcelona office that is monitoring universal health coverage, that is monitoring people being pushed into poverty as a result of out-of-pocket payment, needs to continue, because as the fiscal space for investment in health shrinks, this is where we can expect more and more people to find it difficult to access public health services, which are already under huge pressure, and to have to resort to independent means of funding their own health services. Those who have the means could be driven into poverty. Those who are poor already are just going to remain excluded. And then the important points also made by Carlo, who was speaking on behalf of Italy. And here we see the tensions, for example, when it comes to the commercial determinants of health. The unfinished agenda when it comes to tobacco. Just last week, there was an important meeting in the Western Balkans where they are still having to make important decisions, legislation, policies on tobacco. But then the whole agenda when it comes to the wider commercial determinants of health, a report that was launched under the Belgian presidency that was commissioned also by Belgium itself. And when we talk to our countries across the region, as we go through this very difficult, saddening, and dangerous process of having to deprioritize what we do, we are told time and time again, we need WHO, we need WHO Euro to remain there when it comes to health security, because of course we have ECDC, but health threats don't recognize borders, don't recognize political or customs unions. They go beyond. So we need to maintain that architecture. We are told also that countries are struggling with health workforce, with mental health, two topics that remain on the top of the agenda. And many countries, particularly smaller countries, are saying to us, please remain by our side to hold our hand when it comes to tackling the commercial determinants of health. Because rather than seeing a space for public health to prevail, we are seeing our space being constrained, and it's only WHO who can continue to be there for us to provide that evidence for policy decisions to be made when it comes also to the terrain on commercial determinants of health. Avi, you asked me to be short. I hope I have stayed within the time that you have given me, but just a final word of deep appreciation to all of you. And we must continue to work together. On our own, WHO alone is weak. EUPHA alone, ASPHER alone, any national public health institute alone cannot stand in these difficult times. But I remain convinced that together we can be strong. And in spite of the adversity that we are facing, in spite of the deprioritization, we are also overwhelmed by the support that is coming from even sometimes unexpected quarters in order to say, okay, if you have to stop doing this because you don't have the money, we are going to see how we can fit in and support in kind or otherwise, because we do know that also at national level, health institutes are facing severe budget cuts too. So we are all going through difficult times together, but if we stick together, we will prevail, and we must not be afraid to continue to repeat the messages that need to be said. Thank you.
Thank you so much, dear Natasha, for your exciting and inspiring words. And indeed, we should stick together and we have strengths together. And thank you so much for this. And I'm very happy to move to the next session of this webinar, which is a short presentation of ASPHER task force activities on this issue. And I'm very, very happy to welcome Ariane Bauernfeind and Alison McCallum to speak. So please go ahead.
Thank you, Avi. So when we think of the World Health Organization, what comes to mind? Yeah, for many, it's what we see in the headlines, pandemics, health alerts, treaties. But yet this narrow focus often leaves out the full scope of WHO's work. And even among healthcare professionals and public health students, there's a surprising lack of awareness about WHO's broader functions. Some students have even admitted that throughout their medical or public health education, they were never really taught about WHO's role beyond emergencies. This is why, as ASPHER, we took the initiative to develop the briefing paper, WHO's role in a changing world and why it still matters, to pull together WHO's essential functions, its mandate, the areas where reforms are needed, and how we, as the public health community, can stay engaged. WHO is not just a crisis responder, it plays a crucial role in setting global health standards, ensuring equitable access to care, coordinating international health efforts, and strengthening health systems worldwide. Without it, the global response to health challenges would be fragmented, inefficient, and inequitable. But WHO is at the crossroad. It faces pressure from shifting political landscapes, funding constraints, and the growing spread of misinformation that undermines trust in science and global health institutions. Now, more than ever, we must engage not only to support WHO, but also to help shape the future of global health governance. So what's next? We invite you to join this conversation, read the briefing paper, contribute to discussion. You can use it for briefings, to engage with your health workforce, to inform them, to advocate for a stronger, more transparent and well-supported WHO. Global health depends on solidarity and collective action, and each of us has a role to play in ensuring WHO remains an effective force for health equity, science-based policies, and international collaboration. So let's work together to keep this on the public health agenda, and we are very glad to see you joining already this webinar to spread the word. To take us through the key messages of the briefing paper, let me hand over to Professor Alison McCallum from the Edinburgh University. Alison.
Thank you very much, Ariane. I'm just going to share my screen. The document was, here we are. Yeah, I've got it. And I'm just going to put that onto slideshow. Yep. Whoops. Okay. So thank you very much for this. I'm going to just take you through the report very briefly. WHO's role as a building block and the cement that holds it together as an umbrella for equity, justice, and even-handedness, and that things would fall apart without it. The reason that we put this report together, as Ariane has said, is that we felt that as schools of public health, we needed to do this because each generation of leaders, teachers, researchers, practitioners, and students needs to, and our partners, needs to relearn all of WHO's functions, that they come from WHO, and that together we have a role in their stewardship. And as we go through this, I was reflecting that as a public health doctor by background, from my days as a medical student, I used things like the norms of WHO, the international non-proprietary names, the ICD coding system, as a public health practitioner, I used the international health regulations at local operational level. I used the policy documents that came out of WHO to point out that my member state had agreed them and what we needed to do at local level to try and help achieve that vision, but also in my research and in our work as schools of public health with national public health institutions, with WHO and with the WHO collaborating centres. So one of the things is clearly that the building blocks are the institution, the tools that WHO and together we provide, but the cement, the thing that is necessary, so it's not about individual projects, is the people, the relationships, the shared understanding from local to global that happens when we work together. Like any institution, there are cracks, there are mismatching bricks and so on. The cement always needs to be renewed, replaced, together. So these are the things that we think are broadly the unique role of WHO in global health that we have talked about and you've seen examples of to date. So as an umbrella organisation, WHO has convening power. We have these non-industry-led norm-setting international agreements. A reminder that the non-WHO ones tend to be largely industry-created and industry-led. And this speaks also to WHO's role in equity and even-handedness and managing and minimising conflict of interest. It allows us together, even where politically we disagree, to ensure that we can use WHO's convening power to come together in a safe space to collaborate, to experience support and solidarity, and to disagree and come to a common understanding. It helps us when we need to put extra effort on health equity and access, to have that support behind us when it's more difficult locally, and it has this stewardship of scarce and shifting resources. And we talk in the report about the tiny amount of financing and the imbalance between the core funding for the whole institution and the funding that can be politically directed that goes just to programs. We feel that without WHO, and there is clear evidence of this from the governance of other institutions, that things would fall apart. We would lose that even-handedness and focus on equity and justice. We would have uncoordinated responses. We wouldn't have global health regulations. We would have even greater increased health inequities. Efforts would be fragmented, we'd be talking past each other, spending a lot of time trying to sort things out because we weren't speaking the same language in global public health. We would have our efforts fragmented. The world would have poorer health. Our health workforce, health and well-being would go down as they would face all of these extra barriers, and it would in fact cost more. So we talk in the report about the start of a conversation for what's next, but we wanted to end this thinking about why we have a clear, simple message about why WHO is indispensable, and that if it didn't exist, it would need to be created. Thank you.
Thank you very much, Ariane and Alison. And for closing reflections, I would like to invite Emma Rawson Te-Patu from the World Federation of Public Health, the president of the federation, and John Middleton for a wrap-up. So, Emma, please.
I think Emma's left the call. Yeah. Shall I comment?
Yes, she wrote
Yes, you can
that
start,
she's
John,
leaving.
and I'll try to contact with Emma.
Okay, well, I'll leave you with my finishing comments, Avi. I'm John Middleton. I'm the Vice President of the Global Network for Academic Public Health. This is a relatively new organization in which ASPHER, as the Schools of Public Health for Europe, is one of the members. We have 7 regional associations from around the world, and overall we represent something like 500 schools and programs of public health. We greatly value our work with WHO. We're centrally involved in the roadmap for health workforce development, the public health and emergencies workforce, and developing competencies, curriculum and capacity in public health. If we didn't have a WHO, we would have to invent one for all the reasons that Alison has described and all the local experiences that countries have described here today. It seems to me the world is no longer divided into north and south or east and west or left and right. It's divided into the super rich and the abject poor. It's divided into the technical supremacists and the rest of us. And it seems that this new generation of the tech bros and what we're seeing from the US is the move towards techno-feudalism in which greed and mastery of the rest of us, turning us all into slaves, is what we are witnessing. There is no respect for scientific knowledge. There is no respect for professional expertise. We can hear the opinions of the influencers and the commentators and the secretaries of state of health departments, but real scientific expertise is to be derided and to be ignored. And public health is no longer just challenged in these issues. It faces an existential threat. Nevertheless, as Natasha has reminded us, we have to stick together. Solidarity is the #1 word for how we approach these threats to the health of the people that we serve. It's essential that we stick with our values. We cannot fight fake news with fake news, and the barrage of disinformation that we're confronted with has to be addressed with our science, calmly, coolly, and firmly delivered. In addition, we have to hold true to our values. We have to hold true to saving lives, preventing disability and deaths, seeking for equality in access to healthcare, seeking for equity in the delivery of the services that we provide. And we have to do that working with our colleagues at global level, of which the World Health Organization strongly represents us. So thank you for that. Thank you for organizing this event. And you have my commitment to work both with ASPHER and EUPHA, and also with Emma from the World Federation of Public Health Associations. Thank you very much.
Thank you very much, Professor John Middleton, for your very important words. And before I wrap up the webinar, there is one question from the audience to the panelists. So I think it's worth asking it. So the question is, do we now need to consider how to integrate WHO country capability into national public health agencies and institutions, retaining the strong regional and global networks, but potentially reducing the cost of maintaining separate institutions? Or what would that compromise WHO independence? So I would be very happy if one of the panelists can answer.
I can try.
Yeah.
Go ahead, Dorit.
No, I think it's more WHO can respond to that, but in my opinion, it's a very good idea, and it's very good to really make close ties with the schools of public health, with WHO, closer ties, I mean, in specific areas. And I think we can use the WHO collaborating centers. This is the great way to assess in each of our schools what are the strengths, what we can contribute, and really work closely as ASPHER, but with WHO to provide this kind of full picture into the world. Great idea. And we already, I think, have the platform.
Thank you very much, Dorit. And I would like to close this webinar by calling for action. And this action is to speak up for public health and for WHO. We, ASPHER and EUPHA, will prepare guidance materials for those who wish to take actions. And we encourage you to use them and encourage your members and students to join together. In other words, ex unitate vires, unity is strength. Thank you very much.
Thank you. Have a great day.
Thank you.
Thank you.
Thank you. Bye-bye.
I'll keep reporting from the
Thank
paddle.
you.
Thank you.